Welcome to UD Talks, the podcast brought to you by United Drug, Ireland's leading pharmaceutical wholesaler and distributor. Along with our host, Denis O'Driscoll, we're here to bring you the latest insights, trends, and innovations in retail pharmacy. Each episode, we'll dive into a range of topics that matter to you, from cutting-edge pharmaceutical developments to the day-to-day challenges faced by retail pharmacies. We'll be joined by industry experts to share insights and explore the future of pharmacy in Ireland. UD Talks is your go-to source for staying informed and inspired.
The content of this podcast is intended for pharmacists, healthcare professionals, and individuals with a professional interest in community pharmacy. While every effort has been made to ensure the accuracy of the content within this podcast, United Drug cannot accept responsibility for any mistakes, errors, or inaccuracies. Listeners are strongly advised to verify the information contained in this podcast with a relevant healthcare provider or seek medical advice where appropriate before acting on any information provided. United Drug shall not be liable for any loss or damage arising from the use of the information contained in this podcast. This disclaimer operates to limit United Drug's liability under contract, tort, including negligence, or statute. This disclaimer is provided to ensure that listeners are aware of the limitations of liability before they rely on the content. By continuing to listen to this podcast, listeners signify their assent to this disclaimer.
Hello everyone, and welcome to this evening's podcast on sepsis and sepsis awareness for pharmacists. I'm delighted to have as part of the podcast this evening Joe Hughes and Karen Phoenix, whose son died of sepsis in 2018 and are part of the campaign of Lil Red's sepsis campaign. I'm also joined by Lorna Quigley, a pharmacist who's currently the Programme Manager for the National Clinical Programme in Infectious Disease and was the former Programme Manager for the National Clinical Programme in Sepsis, and Dr. Michael O'Dwyer, who's the Clinical Lead for the same programme. So I'm very happy to have you all here this evening, and thank you so much for coming on to the call. I guess, Joe and Karen, from your perspective, and then maybe, Michael, I might drag you into maybe follow up, is the prevention and early recognitions from your perspective for your son. What was it that were the key signs now that you would say that are important to be noted?
We knew nothing about sepsis, so looking back on it now, on it, the knowledge that we've learned, some of the key symptoms, infection has to be present first. So any type of infection, sepsis can hide behind. But some of the main ones was passing no urine in the day and feeling confused, severe breathlessness. Our son was panting, and the skin was mottled and discoloured. So there were signs, symptoms that we hadn't a clue what they were, which we do know now in hindsight, that every parent or guardian, or indeed any healthcare professional, should be aware of the symptoms of sepsis. But the main thing is infection has to be present. Okay.
And Michael, from the clinical side of the house, the classical signs that present clinically on a patient presenting with sepsis, what are they in very simple terms, just as so people will remember kind of what to remember for the signs and symptoms?
Yeah, well, I think there's a couple of things to bear in mind is that the topic is really complicated. And the reason that the mortality rate from sepsis is so high is that it can hide and masquerade as many different illnesses. And, I'll give you a list of symptoms that can be present, but any of those could be present, all of them could be present, and sometimes none of them could be present. It's a really, really difficult disease to try and recognize. It's difficult within the hospital system, it's difficult for doctors to recognize, and it's really difficult for parents and patients themselves to recognize at home. And the symptoms all come about because what happens is that you have a simple infection that's what starts the cascade of sepsis, if you like. It doesn't have to be a bacterial infection. Viral infections like flu can cause it, like COVID can cause it. But what happens is a normal, healthy immune response that normally gets rid of that infection becomes dysregulated and out of control and affects the whole body, so that you start to get and see signs in areas of the body that have nothing to do with the infection. So if you imagine it starts perhaps from a kidney infection or from a cut on your hand, people might recognize. And then you get these symptoms that have got nothing to do with, for example, that cut on your hand. And as the immune response becomes very dysregulated, you get things like people who are breathing very fast, people who might have, maybe easier, best to remember as that acronym of sepsis, where you might get slurred speech or confusion as the brain is affected. You might get shivering or very extreme muscle pains are reported back to us time and time again. And when the kidneys get affected as part of that whole body response, they stop working. And what you notice is that you don't pass urine, or parents might notice that their kids don't pass urine. Again, the lungs can get infected even when pneumonia isn't the beginning of the infection. The immune response can separately affect the lungs, and people get very short of breath. And survivors will tell us the I is for people saying that I feel like I'm going to die. And survivors of sepsis come back and tell us this, that it's the most awful feeling that they've had in their lives. And that's something not to be disregarded. And then skin changes is the final S. And that's because your blood pressure gets affected. Your blood pressure falls, and so your skin becomes mottled and can become quite cold and discolored. But by no means do you have to have all of those signs and symptoms, and sometimes have none of those signs and symptoms. And I think a really important thing for people at home is that they're the ones that know their kids the best, they know their elderly relatives that they're looking after the best, and they know when there's something not right. And it's to heed that intuition and to come and seek help. And again, even if you've begun the treatment, you've been to your GP, you've had some antibiotics, and you go back home, it can still progress even on antibiotics. So a classical picture again would be somebody who's just not getting better. They're 2-3 days into their illness. They still can't get up off the couch. They can't do anything. They're just not functioning normal. And it's not to disregard those people who just aren't getting better. You know them better than anybody, and you know that something is wrong.
Okay. And from the perspective of knowing those signs and the complexity associated with them, as our audience out here is pharmacist and pharmacist based, from the perspective of yourself, Lorna, is there anything that you would see that pharmacists could be involved or would have a role in sepsis? Maybe not so much detection, but maybe prevention and awareness.
Yes, I think pharmacists can play a key role in prevention and awareness. So we know some things around trying to prevent sepsis. Obviously, you're trying to prevent infection. So good infection prevention and control methods, vaccination, if there are infections where people can be vaccinated. If they are on antibiotics, I suppose things like if they get wounds, just to keep wounds clean. For new mothers, if they're, breastfeeding is obviously in theory an infection prevention and control method. So it's, I suppose around that is a piece around the prevention, and then around the awareness. Like I think that pharmacists, we know they're a very trusted healthcare professional. A lot of the public do come to pharmacists asking for advice and everything. And I suppose it's just the safety netting piece, as Michael kind of alluded to, as well. A lot of community pharmacists are very familiar with a lot of their customers. So if they are coming in and they're acting a bit different and they're concerned, that there is the safety netting piece about reminding them, about the symptoms and signs of sepsis, just to call their GP or, attend the hospital if they have signs and symptoms. And I suppose the piece around antibiotics as well, as Michael said, just that if they are on antibiotics and they aren't getting better, just to be careful and that they may be developing sepsis, and to be aware, I suppose, of those that are at high risk as well, for high risk patients.
For me as a pharmacist and practicing pharmacist, it sounds like something that can be very, as Michael, you mentioned earlier, hidden. And I guess, Joe, from your perspective, and Karen, it was very hidden, the whole idea, and it was because you weren't sure of it. Can you kind of give an idea about, for you, did you see anything other than the not passing urine, or was there anything more that we need to, from your perspective, from your own personal experience?
Really, what Sean had that day in question, he had 4 of those symptoms that are related to sepsis, and I hadn't got a clue about any of them. And it was only afterwards I was shocked to my core that Sean had all them and I didn't recognise them. So I just want people really to be vigilant and learn and just be aware about sepsis when there's an infection. As Michael said, sometimes they won't present themselves, the symptoms won't, but if they do, and like that, if they feel that their child or their loved one needs looking after, or they suspect something, just to bring them into A&E and ask, could it be sepsis?
Time is critical. The golden hour in sepsis is, again, just to say, United Drug and Lloyd's Pharmacy are to be commended on what they're doing here today. They're bringing the awareness to a whole new level, and we take our hats off to it. And the one main thing about sepsis that sticks for us is that it does not discriminate. Young, old, fit, healthy, it doesn't matter. Anyone can get sepsis, and how hard it is to get an appointment with your GP, where a pharmacist with a bit of knowledge around sepsis would be beneficial.
What you said there was quite interesting, Karen. You said that you hadn't a clue what sepsis was. You had no idea as a parent. In that way that Lorna alluded to, that pharmacists are a well-trusted profession, is there anything that you would see that pharmacists could be doing more of around making their customers, patients more aware of sepsis?
Well, I think with the new leaflets that have been printed as well, that you can download from the website, I think maybe when people are collecting their prescription, maybe put a leaflet in every single prescription that's given, which that's awareness in itself, without even the pharmacist having to say anything, because pharmacist is not there just to put it in the bag. I think with a prescription, I don't think people would mind that.
And Lorna, do you think there's anything more that as a profession that we can do from our perspective as an organisation?
I think there is certainly some work done on antibiotic stewardship. I think we could always be doing more. I do think that with community pharmacists, I think that, I suppose from what I hear from community pharmacists is that they don't really have dedicated time for learning. There's no mandatory learning on sepsis. So again, it's kind of pharmacists have to go off their own initiative if they're going to learn something about sepsis. It's not, I don't know how well it's covered in the undergraduate program. I don't know the answer to that, but I wonder, is there scope to see about more training for pharmacists so that they are more aware of it? But, again, it's one of those things that I think that they may not see it very often. But when it does come up, obviously, it's very, very important. So sometimes things go out of your head because obviously there's an awful lot in healthcare. So again, I just wonder if there's some scope for some kind of refresher training of sepsis every couple of years, similar to the way there is now in the HSE, that they are recommending that you do, every 3 years and 3 to 5 years that you do mandatory training. So whether there is scope to do that for community pharmacists as well.
Going back to kind of the interdisciplinary piece around this, because obviously that people knowing the signs of sepsis, the referral pathways, Michael, for a pharmacist, let's say if a patient comes through the door or their parents or whoever, what is the best way for that referral to happen? Is it just tell them to go straight to A&E, go back to their GP? What if you had any concern around it?
Giving a sort of didactic advice here is really difficult because it presents at all sorts of different extremes, and can develop really, really quickly, and also can be quite insidious and slow, and may respond to just antibiotics by tablet at home. So it's always a balancing act between fear mongering, if you like, that there still is a big cohort of patients here. And now, the vast majority of people who develop infections will get over them with no antibiotics or with antibiotics. And we have to be really careful about, I think, two things here: the over-prescription of antibiotics because of a fear that, viral illnesses are maybe bacterial illnesses. And, that might be something intuitively that we think we should do now, but in 10 years down the line, if we prescribe antibiotics for all of these patients, the resistance rates will go up and we'll be left with no antibiotics to treat these patients. And the other thing is the stream of patients into an already overcrowded ED in patients who may not need to be in that emergency department. So the messaging has to be quite nuanced. And unfortunately, because of the nature of the disease, there aren't strict criteria that we can tell people if A, B, and C are happening, you need to go into the emergency department, or no, you're okay to go to the GP, or you can go back home with your antibiotics. It's really a balancing act trying to get this right. But I'd say, again, it's back to that piece of who knows the individual best. And it's the person who lives with them, who looks after them, and who cares for them. And they know when something's not right. And I think those family members will know if they feel that the advice to go home and take some antibiotics or to go to your GP in a day or two isn't correct, then they should be going into the emergency department.
Okay, so that kind of leads to a question that I wanted to ask was about specific policies or guidelines for pharmacists out there in sepsis. Is there any go-to information site, obviously, on the HSE? Is there anything else? Lorna, you alluded to HSE land, I think. Is there anywhere that in particular would be useful?
I think obviously you have the HSE Sepsis Programme website, which has an awful lot of information on it. There was an IPU article done last year for the role of community pharmacists in sepsis management. It was community pharmacists and hospital pharmacists, and just to give more awareness on sepsis. As we say, we have the sepsis leaflet, antibioticprescribing.ie around antimicrobials. I don't think there's any specific policies / guidelines that would include community pharmacists. Michael, have you any further on that? I don't think so.
I'm unaware of them specifically for pharmacists, no.
And just from that perspective, the whole piece around the challenge, and we're back to the same issue about how to determine whether or not somebody goes forward or goes into the system because of a concern with sepsis, is really, Michael, and down to kind of the person knowing the patient best is the one that should follow it. So with that, I'm going to be very crude here, and that kind of is down to a gut feeling by that individual.
Down to a gut feeling, and maybe an acknowledgement of high-risk groups as well. I mean, who are the people who are most likely to develop sepsis from an infection? And maybe that actually is a message that should go out. So very young children have immune systems that haven't developed properly. They're more susceptible to it. But a group at much greater risk are the elderly. As your immune system starts to not function as well as it did in your youth, they're the group who by numbers are most prone to this. And then there's specific illnesses, cancers and other inflammatory-based illnesses that affect the immune system. These people are much more susceptible to sepsis, and people who are on specific treatments and are related to those diseases, such as chemotherapy, such as biologic agents for inflammatory bowel disease and psoriasis, and lots of things at the moment. And pregnant patients as well are at a slightly higher risk than the general population. So it's beneficial that the public know who the at-risk groups are, and in the context of being in one of those groups and you're suffering some of these symptoms and you're not getting better, absolutely there's somebody who should be seeking urgent help.
And I just interject there for a minute, Dennis. While I agree totally with Michael and Lorna, speaking as parents who had lost a son to sepsis, he was failed by 3 sets of medical professionals. We are not, and we never claim to be medical professionals. And our advice would be, if you think there's something wrong, just ask, could it be sepsis? Escalate it. Why not start at the top? Why not start at the most drastic thing it could be and walk backwards? Definitely, lives would be saved.
And plus, as well, as you said, people have that gut feeling about who they live with. I had that gut feeling that there was something seriously wrong with Sean. But I remember in 2018, the Aussie flu had hit Ireland. And there was ads on the telly from the HSC telling people not to come to hospital with flu. And that's what Sean was being treated for, was a flu and a chest infection. And it was only later when Joe went into Temple Street after Sean passed away, he had a meeting with the doctors that were on call that night. And they actually said that Sean would have been sent home because he only had a flu and he was already on an antibiotic. So the onus shouldn't be on the parents as well to recognise sepsis either. It should be literally in your face. No, parents should know this, like I should have known. There was a sepsis awareness program in place in 2014, but we still heard nothing about it until Sean passed away. And that's why myself and Joe started up the Lil Red's Legacy campaign, sepsis awareness. So it literally needs to be in your face about the signs and symptoms and to be vigilant.
So, Karen, what you're saying is just ask the question, could it be sepsis? Is a very important and valid question to be asked. And as you said, Joe, already, to escalate it to the highest rank and then work your way downwards. And I guess that's what, Michael, you've alluded to, and Lorna, is the complexity of it, that it's not the most simple thing to diagnose or to determine what it is. And therefore, things can happen that unfortunately led to the events of for Sean. But the other thing then, Karen and Joe, from your perspective, from the campaign start off, because as advocates, as you said before, Joe, you're accidental advocates falling into this, that you'd never wish it to happen to anyone, and just you're there and you're shouting about it. Would you say that there's been a better improvement, a better knowledge gain within the health sectors around sepsis now versus when you started the campaign first?
100%, because just for instance, now, unfortunately, we had to do a public petition and get the HSE into the directors and ask them to ramp up their efforts around sepsis awareness, public sepsis awareness. And on the heel of that, they get brought out, and the HSE have to be commended for what they have done since then. They have definitely ramped up their efforts around sepsis awareness in the public and in the healthcare setting. One thing that we take pride of now, that sepsis training is mandatory for healthcare officials, healthcare workers, and it's ongoing. As Lorna said earlier, it's every 3 years or every 5 years. It has to be updated. That's a big plus for us. We're a grieving family, and we would know nothing about sepsis only you knocked on our door and took our son. We have a great following on social media. We host and fund many public awareness events throughout the year, all accumulating, especially around September and the 14th of September, which is World Sepsis Day. We're just two grieving parents and a grieving family, our daughter as well. Imagine what we could deal with. We were a big company, a big conglomerate like the HSE, and many more lives could be saved, because you can't put a price on lives. Like, one thing is, I've asked Dr. Colin Henry, Chief Executive Officer of the HSE, I asked him if it was his child that had sepsis, would he be happy with the level of awareness? And the man said no. And I appreciate him for his honesty.
Joe and Karen, I think, kindly said the HSE are to be commended, but I think it's Joe and Karen who need to be commended here, because none of what happened over the course of this year in terms of the public awareness radio and social media campaign would have happened if it wasn't for Joe and Karen going to the politicians. And this works in a sort of a circular way, if you like. These are things that we want to do, but they're, as a program within the HSE, we don't quite control the budgets. And even our bosses don't quite control those budgets and don't have a precise say over what happens to them. And what's really helpful is that you have grieving parents who have way better things to do with their time than to relive this tragedy time after time. But it's because Joe and Karen have reached out to their politicians, who have brought us into joint Oireachtas committee hearings, and the HSE have then sat up and listened, and that's given us the funds to help with these public awareness campaigns. So I think it's those guys that need to be commended in this instance.
Thanks, Michael, and I concur with that. I think the advocacy, as you said, from people who know about this is much more powerful than people who work within the organisation trying to get things done, because you need sometimes that external pressure to put the finger pointing in to make sure things happen within that organisation, and that funding follows it, because it's all well and good. I think, Joe, you said to me before that it seemed to be before in 2014 when there was a sepsis program in the HC that was more like just there to say it was there rather than they being proactive. Whereas from what I've seen, I'd agree with Michael, and maybe Lorna, you might step in, that in the past 12 to 16 months, for me, the whole piece around sepsis has just ramped up extraordinarily. And the whole piece around mandatory training is a very important aspect, I would say. So from that, I would say as a pharmacist, it should be almost part of our part of our CPD training, that we should undertake sepsis training going on to HSC land, because as pharmacists we can access that from the community pharmacy, rather than actually being within the HSC. So that's something important that pharmacists could do as an education point from this evening. Joe and Karen, just back to you. Is there, if tomorrow morning that there was funding readily available, what is it that you'd want done additionally with the sepsis campaigns that are out there at the moment?
We fundraised a number of years ago. What they were doing, they were trying to develop a rapid blood test device that would be hopefully be in every hospital, every doctor's office. That is like a diabetic blood test. That it take your blood and tell you the likelihood of having sepsis. The lives that would save, that's the ultimate goal. We were always about the awareness. We didn't want to reinvent the wheel. Why we thank Michael and Lorna for the kind words.
Yes,
thank you very much. It's only when we sit down and other people say the amount that we've achieved. If tomorrow morning, what would we want? All we ever wanted was the awareness. Let someone else with deep pockets and a better background to take it over, because we don't have it in us no more. We'd love to see, our ultimate goal is, when we read up, basically, sepsis is hide behind any infection, but not every infection leads to sepsis. Greater awareness would definitely save lives. So for us, it was always about the awareness. We would love to see an advertisement on Irish national television, because everyone is on the telly, watches the telly, especially around the news and that. But if we had the money, that's what we'd be funding ourselves. There's no magic pill. There will always be infection around. As long as people are living, there's been infection. There's no magic pill, unfortunately, Dennis.
Okay. And Michael, that leads on to a question I had, and Lorna, you might be able to step in as well. Thanks, Joe, for leading in about, this rapid diagnostic testing. Is there a future in that? Is there other digital health tools that are out there that can help with more rapid diagnosis of sepsis?
Yeah, so it's been a holy grail in the global community and including the industry. So there's no expense spared worldwide in trying to develop a test, and a simple test that'll tell you yes or no whether you have sepsis. And currently, we talk about blood cultures, which is the gold standard for infection diagnosis, and then sepsis after that. But that's negative in about 50%, maybe more, of the people who we know have sepsis. So our gold standard test is terrible. And it's just a feature of the way that microbes work. They live on us, they live in us. We can detect them far too easily. And it's trying to tease out the difference between something that's just living on us and helping us versus something that's infecting us has become, is just a huge issue. The amount of money globally that's gone into those tests, I've been involved in many different studies of all of them, they've all been disappointing. And it takes us back then to the clinical decision making, whether that's a family looking at their loved one wondering, is there something wrong? Whether that's a doctor relying on tests that, to be honest, are not a whole lot more sophisticated than that. You're looking at vital signs and you're trying to predict what's going to happen in the future. Is there a future in terms of big data, wearable devices, stuff like that? Absolutely. But it's just not there yet. And I don't think we're quite even on the cusp of it. I'm not seeing stuff coming out that's anywhere close to being incorporated into day-to-day practice. And it's back to doing what we're trying to do. The program started by increasing awareness within the hospital. The program started because of a tragic death within the hospitals, educating the hospitals with the tools that we have, and then out into the community. And it'd be fabulous were we to get a test in a similar way to how cancer has become so sophisticated in terms of its diagnostics and its treatments for different types of cancers. And the improvements in survival are just phenomenal. And if you take that as a sort of gold standard, where we are in sepsis care is in the dark ages. We're using the same tests that we've been using for the last 40 years, more or less the same antibiotics that we've been using since antibiotics came around. And trying to move beyond that is proving really, really difficult.
Okay. And yeah, that's interesting that, yeah, you're right that we, like from my perspective, like as a pharmacist, and I'm sure from my colleagues out there, it's very much a lot of these tests, diagnostics tests, point of care tests, still aren't 100% there for a lot of other conditions as well. Like it gives you an idea, as I call it, a rule of thumb, to kind of give you an idea what to do next, rather than it being the complete holy grail, as you refer to it as. And Lorna, do you have anything from your perspective that you would see from the programme of future technology being used for sepsis management?
Probably nothing more than Michael has mentioned there around technology. I think that, it's even helpful as when there are developments in other conditions, because we know a lot of medicine is also about ruling out other things. So, the more that things can be ruled out as well, and if you have then the signs and symptoms, then you kind of have to go with the early antimicrobial use, etc. But I suppose it's, again, just highlight in the antimicrobial piece as well, that obviously you do need to examine 6 to 12 hours later and just make sure and step down the antimicrobial if it's not appropriate. And just as well, one further point, just coming back to technology, I actually just had one comment from a community pharmacist. I suppose my background is a lot of working in a hospital setting, and in the hospital setting we have a lot of different apps, and I know we even had an app around sepsis, and it was sepsis symptoms, does this patient have these symptoms, and if they had a number of symptoms, it was yes or no. A community pharmacist perspective I got is there are very few apps for community pharmacists, so for them to try to find the information, it can be quite difficult. Whereas again, I don't know if there is capacity around an app where they have information on various things, not just sepsis, but various things, where that if a patient does come in, they can go, oh wait, I'll just check, go through a checklist, and here you go, and it gives them the opportunity to respond fast. Because I know a lot of the time community pharmacists, they are very busy, they're doing lots of different things, and while their role is very much counselling, and they should be very much counselling, they do have an awful lot of different jobs going on. I hear there's an awful lot of admin that does take up their time. So if there's any technology that can be used to make it even quicker, that they can go, yeah, grand, this patient is a high risk group, because we all know we can forget things, so it's just making it as easy as possible to actually pull the information.
So it's like a back to basics. So it's like to make sure, as what Joe and Karen said, the ideal thing is awareness, making people more aware, and how we can ensure that awareness is given out to both our patients and people in the community. And I think a really important piece in this is that as healthcare professionals, that we're kind of part of that training piece, that we take up that training as healthcare professionals. From your perspective, Joe and Karen, is there a point in time where you would want everything to be like it's perfect and that's it, that's us done? Or is this like, I assume from your perspective, this is going to be a lifelong campaign to make sure you get the best out of all of this?
It will be. It's a lifelong campaign because of the association it has with our son. So it's his legacy. All we do the research, we put it out there for people to take it up. We progress from just from smartphone putting up posts every day to having our own website and doing the likes of these podcasts and going to Dublin Castle, the Sepsis Summit. We've been in Leinster House more times than some of the politicians that are paid to be there. We seem to go from strength to strength. But as I say, we're grieving parents, and they're coming to do this morning. When we agreed to do it, we were in a different place in our heads than this morning. So, it's not a job to us, and Passion is the wrong way to put it, but the public deserve to know the dangers around sepsis. And as soon as somebody else takes over the torch, we'll be happy enough. But again, the agency has been commended in the past year and a half, what they have done, leaps and bounds. We just hope that it continues.
Yeah, that's all we want, is that it will continue, that we can definitely take a step back then. You know, it's still going to be ongoing, even if we're not doing anything for a few months. You know that way?
Yeah.
Just to keep it up,
You know,
like all the other campaigns around illnesses in Ireland.
We've been credited with bringing sepsis awareness to Ireland. But, you know, as I said a number of times this morning already, we're just a grieving family, and we've been credited with bringing sepsis awareness to Ireland. We're not medical professionals. We're not the health service executive. Why? Somebody said to me, but why would they be doing it when you're doing it? So let them do it, and we can take a step back and take a breath, you know.
And Lorna, from your perspective, as the former program manager for sepsis, what is it that you think the HSE needs to do to continue to ensure that sepsis is kept at the forefront?
Well, I think it's doing a lot at the moment. I mean, again, Michael might be able to answer better what's going on in the programme at the moment. But I think, again, and thanks to Joe and Karen, you know, there probably was investment in time, and even I think consideration around what the programme was doing and whether or not that was actually kind of satisfying the patient public piece, as in whether we were doing the right thing. So we were doing what we thought was right, but was it actually right? And, you know, from the public's perspective. But I think that there's an awful lot going on. Well, there seems to me anyway that there's an awful lot going on around awareness, which is a key piece for the public. Obviously, they're looking at management in the hospital setting as well. I would say as well, you know, I think having come on the programme as a pharmacist, I probably didn't appreciate as much the role that a pharmacist could play. So even from my own point of view, and this comes back to, again, the more awareness, you know, you certainly learn and you become more hypervigilant about it. So I'm certainly way more aware of sepsis. Obviously, I haven't worked in the programme, but also thanks to Joe and Karen, you know, that there was a bit more of a, yes, we do need to put an impetus on this and put it, you know, make it a priority. So, but as I say, from the HSE's perspective, I think Michael might be able to answer better on what's kind of going on the programme now. So I'll let him answer that piece.
Yeah, the programme was, like I say, started in response, and it's awful that these things have to be reactive, but they very frequently are reactive. And it was started in response to an avoidable in-hospital death. And so the focus for the first number of years was around the education of healthcare staff and the recognition and treatment of sepsis. And that work's not done, because there's still avoidable deaths within the health service. We're better than we were, but it's still happening. And most of our efforts are within that sector, because it's not perfect. And it's down to the size of the health service, the number of people that patients interact with, their level of education and their background. And it's a huge job to try and do. But we recognize, and, you know, we write about the steps that need to happen, and that hospital piece is stuck in the middle of it. But that process involves a patient or their relative knowing that something's wrong. So there's the public awareness piece. But that individual then has to seek help somewhere. And so we're looking at the hospital piece, but there's a whole primary care GP piece there as well. And that's been missing from the link. So we have engaged with the GP program. We now have 2 GPs, one for pediatrics and one for adults, in on the program as well. And so we need to develop that missing piece between the patient and the hospital and build up that primary care awareness. And that's something we're working very hard on. There's the reintegration of the healthcare services in the community sector within Sláinte Care is something that we're going to have to focus our attentions on as it happens this year. And then there's a whole other piece we haven't even mentioned, which is for sepsis survivors and the post-sepsis syndrome and the trauma and the illness that they suffer after their sepsis. So there's that whole pathway, and it's taken a long time because there's an awful lot to it, but we know where we need to be. And it's about trying to find the resources to do all of that together and to bring it together. But people will always die of infection, will always die of sepsis. The mortality rates are too high at the moment. And our objective is to try and stop the avoidable deaths. They're still happening, but we know where we have to act. And then after sepsis, there's this whole other piece about post-sepsis syndrome that, again, is something that needs an awful lot of work and investment. And it's not there. And it's not there globally. It's not just in Ireland. There's very few jurisdictions that have any sort of joined up thinking about what to do with these patients afterwards.
Okay. That's a very interesting point. I hadn't even, sorry, Michael, it sounds terrible that I didn't even consider the trauma associated with surviving sepsis. And last point, maybe Joe Karen, you might have in here, if you were to give one learning piece to a pharmacist who doesn't really know a lot about sepsis, is aware that it exists in the background, got sent leaflets last year, what would you say they should be doing tomorrow or the day after listening to this podcast?
We've been thrown under the bus with sepsis awareness, and we got from under the bus, and now we're sitting on the bus. We educate ourselves. We never heard of the word sepsis. So, like you as a pharmacist, if there's something you don't understand or you're not sure of, the National Sepsis Awareness Programme was set up in 2014. But sepsis is around a long, long time. There was sepsis deaths before 2014. Everybody, the odds are, everybody knows somebody that had sepsis and survived or passed away. Educate yourself. Look it up. Our own website, the HSC website, there's loads of information out there now. Currently, a lot of people have smartphones and have a few minutes during the day and they're Googling things. Yeah, but if I'm listening to a radio program and I don't understand what that word is, I will Google that word. So self-education, and especially if you have a family, aging family or a young family, doesn't matter. It's not the awareness and to educate yourself on the word sepsis is free of charge.
Thanks, Joe. And Michael, just back to you around the primary care piece, with regards pharmacists being part of that primary care continuum. Where would you see, for pharmacists, you mentioned about the GPs having specialist GPs with the ICGP. I could have picked that up wrong, so I apologise. Would you see there's a role for pharmacists to be more involved, maybe with their colleagues within the hospital structures within AMRIC?
We work very closely with AMRIC. Lorna was on the program as program manager, not specifically as a pharmacist, but absolutely we benefit from having specific pharmacy advice within the program. And then the pharmacists and the community pharmacists play a very important role. I mean, we developed in conjunction with Joe and Karen the leaflets that went out to GPs, but all pharmacies as well. And look, it's really difficult. I know all the pharmacies have them. And I've gone in myself to have a look, but I've got to ask, and they're in a back room, and they're not. The objective was that, you come in with infection or signs of an infection, and that you're given this leaflet so that if things aren't getting better, if these symptoms develop, that you go and seek help. So it's back to that, the bones and the framework of how we want to integrate with pharmacy in the hospital and maybe more importantly within the community is there, and it's just trying to reinforce that message. Okay.
And Lorna, your perspective as a peer pharmacist?
So just with regard to that, so there is a network called PAMSnet, that's a joint AMRIC IAOP, so Institute of Pharmacy Initiative. And this is, I suppose, the idea of that was kind of to link community pharmacists and hospital pharmacists, or pharmacists in all settings, around antimicrobial stewardship. And I certainly used that network while I was on the sepsis program. I was putting up everything. So again, it was to just, get information to the community pharmacists.
Okay, thanks, Lorna. Okay, so I'd like to thank everyone. Thanks, Lorna, for being here today. Michael for here, most especially Joe and Karen, and also just to recognise Lil Red at this point in time. On that note, thanks a million. Talk to you all soon. Take care.